My name is Rania Karim, and I serve as an assistant professor in the Department of Physical Therapy at the Massachusetts General Hospital Institute of Health Professions. On behalf of our research team, I'm pleased to share highlights from our study, Virtual 2-Minute Step Test, Validity, Reliability, and Correlates in Community Dwelling Older Adults. We focused on the 2-minute step test because of its simplicity, minimum space and equipment requirements, and ease of use in home settings. Notably, the 2-minute step test provides physical therapists with meaningful insight into aerobic capacity. Given the increasing integration of telehealth services in healthcare delivery, we wanted to examine the feasibility of administering this test virtually. The virtual delivery of functional fitness assessments, such as the 2-minute step test, introduces important considerations regarding safety, reliability, and accuracy. Remote administration requires careful attention to fall risk and physiological responses in the absence of direct clinical supervision, as well as potential influences from the participant's environment, the setup of video conferencing equipment, and the stability of the internet connection. The primary objective of our study was to evaluate the concurrent validity and reliability of the 2-minute step test when delivered virtually to community dwelling older adults. A secondary goal was to explore the association between 2-minute step test performance and established fall risk measures, including the timed up and go, 30-second chair stand test, 4-stage balance test, and the activity-specific balance confidence scale. For this study, we utilized a cross-sectional design in which community dwelling older adults, those are 65 and older, were assessed on their performance of the 2-minute step test in a single session. The assessment was done alongside the virtual assessment of the functional components of the CDC STEADY, which is the Center for Disease Control and Prevention's Stopping Elderly Accidents, Death, and Injuries Fall Risk Assessment. That research study can be found in the Journal of Geriatric Physical Therapy. For this study, adults aged 65 and older were recruited in Florida, Illinois, and California. One unique aspect of this study is that the administration of the 2-minute step test was performed in the participant's own environment, using the participant's own video conferencing device, internet, and equipment. Scoring was conducted simultaneously by an in-person rater, Rater 1, and a remote rater, Rater 2, both of whom were physical therapists. The participants were responsible for connecting to the Zoom session and setting up the environment. The virtual physical therapist, Rater 2, was responsible for instructing the participant in the 2-minute step test, such as determining the height for the leg, positioning of the camera, placement of the chair for balance, and providing instructions on the performance of the test. The in-person physical therapist, Rater 1, was only present to be available if an immediate safety concern arose. A third physical therapist, Rater 3, scored the video recordings on day 1 and day 30 to assess inter and intra-relator reliability. We had 30 adults participate. The 2-minute step test demonstrated high levels of agreement between in-person and remote formats. Also, it showed good inter-relator reliability and excellent intra-relator reliability. When looking at the 2-minute step test to other assessments, a significant positive moderate relationship was found with the 2-minute step test and the 30-second chair stand test, and fair correlation with the activities balance confidence scale, and a negative fair relationship with the timed up and go test. One subject did experience a controlled fall unrelated to the performance of the 2-minute step test while bending over to pick up the digital tablet from the floor after performing the test. No cardiac events were reported. We did experience some delays in video streaming during 7 telehealth sessions, but not significant enough to warrant a retest. Administering the 2-minute step test virtually highlighted several considerations unique to the virtual setting. The first relates to the testing environment. Participants or caregivers must properly set up the testing space with materials like colored tape and a chair. They must follow clear pre-test instructions to ensure accuracy and safety. The second consideration is the camera setup. The camera should capture both the target tape and the participant's full body to allow accurate observation with a distraction-free setting. Additionally, a video recording can help verify results. A third consideration is connectivity. Reliable internet is essential, as poor streaming can reduce test accuracy. Optimizing connection by reducing competing internet use or testing closer to the router can improve consistency. Through this study, we found that the 2-minute step test is a valid, reliable, and safe tool for the assessment of aerobic function in older adults. When administering the 2-minute step test virtually, a video recording can enhance scoring accuracy. While adhering to a protocol for administration, caregiver support, baseline vitals, and medical review can help ensure safety and consistency.